As we grow older, our bodies change, and so do our nutritional needs. The same foods that once gave us energy might now slow us down, while others can become powerful allies for better health. Surprisingly, some of the best medicine doesn't come in a bottle. It comes from nature, and it's right there in your fruit bowl. But here's the catch. Not all fruits are good for seniors. Some are packed with the right nutrients your body needs to fight aging, improve digestion, boost memory, and protect your heart. Others, though sweet and tempting, can actually lead to hidden problems like blood sugar spikes, joint pain, or even fatigue. So in this video, let's start by focusing on the 3 fruits you must include in your diet, because they can make a real difference in how you feel every single day. And if you're serious about staying healthy and learning more simple food tips like this, make sure to hit that like button and subscribe for more. Among all fruits beneficial for seniors, the jewel-like pomegranate stands out as a true champion for cardiovascular health. This ancient fruit, celebrated across cultures for thousands of years, contains a remarkable concentration of compounds that specifically support aging hearts and circulatory systems. The deep ruby seeds, called arils, burst with juice that contains more antioxidants than even green tea or red wine. For seniors concerned about heart health, pomegranates offer natural support by improving blood flow throughout the body, including to vital organs like the brain. Research has shown that drinking pomegranate juice regularly can help reduce the buildup of plaque in arteries, a common concern as we age. This improved circulation delivers more oxygen and nutrients to your muscles and organs, potentially increasing energy levels and reducing fatigue. The unique compounds in pomegranates called punicalagins help maintain the elasticity of blood vessels, supporting healthy blood pressure levels. For seniors taking blood pressure medications, adding pomegranate to your diet works complementarily with your doctor's recommendations. The potassium content in pomegranates also helps balance sodium levels in your body, further supporting healthy blood pressure management. Inflammation is a major contributor to many age-related conditions, from arthritis to heart disease. Pomegranates contain powerful anti-inflammatory compounds that help quiet this internal fire, potentially reducing joint pain and stiffness. The antioxidants in pomegranates also protect your cells from oxidative damage, essentially slowing down the aging process from within. Many seniors experience decreased immune function with age, but pomegranates can help strengthen your body's natural defenses. The vitamin C and other immune-supporting nutrients in pomegranates help your body fight off common infections and recover more quickly when illness does strike. This immune support becomes increasingly important during cold and flu season or when around grandchildren who might share germs. For those concerned about memory and cognitive function, pomegranates offer promising benefits. Studies suggest that regular consumption may help protect against Alzheimer's disease and improve memory performance in older adults. The improved blood flow to the brain, combined with reduced inflammation, creates an environment where brain cells can function optimally. While eating pomegranate seeds directly provides fiber and the full spectrum of nutrients, pomegranate juice is also beneficial and easier for some seniors to consume. Look for 100% pomegranate juice with no added sugar to get the most health benefits without unnecessary calories. Just 1/2 cup of pomegranate arils provides nearly 1/4 of your daily vitamin K needs, supporting bone health and proper blood clotting. Don't let the small size of the kiwi fruit fool you. This fuzzy little powerhouse offers extraordinary benefits particularly valuable for seniors. With more vitamin C than an orange and more potassium than a banana, kiwis deliver concentrated nutrition in a modest package. This tropical fruit, available year-round in most supermarkets, supports multiple aspects of health that become increasingly important as we age. Sleep quality often diminishes with advancing years, leaving many seniors feeling tired and unrest. Research has shown that eating 2 kiwis before bedtime can significantly improve both sleep quality and duration. The combination of antioxidants and serotonin-related compounds in kiwis may help regulate your natural sleep cycle, leading to more refreshing rest. For seniors concerned about digestion, kiwis offer gentle yet effective support through their unique combination of soluble and insoluble fiber. This natural fiber blend, along with an enzyme called actinidin, helps break down protein and ease digestive discomfort. Many seniors find that including kiwi regularly helps maintain regularity without the harsh effects of laxatives. Vision concerns become more prominent as we age, with conditions like macular degeneration threatening our independence. The high levels of lutein and zeaxanthin in kiwis act like internal sunglasses, protecting your delicate retinal tissue from damage. These compounds, along with vitamin A precursors, support night vision and may slow the progression of age-related eye conditions. Bone density naturally decreases with age, but kiwis contain a perfect storm of nutrients that support skeletal health. The combination of vitamin K, calcium, and magnesium works together to maintain bone strength and prevent fractures. Just one kiwi provides about 23% of your daily vitamin K needs, essential for proper calcium utilization in your bones. The impressive vitamin C content in kiwis, nearly 120% of your daily needs in just one fruit, supports your immune system when it needs it most. This becomes especially important for seniors, as immune function naturally declines with age. The antioxidants in kiwis also help reduce inflammation throughout the body, potentially easing arthritis pain and stiffness. Heart health remains a top priority for seniors, and kiwis offer multiple cardioprotective benefits. The combination of potassium, fiber, and antioxidants helps maintain healthy blood pressure and cholesterol levels. Regular kiwi consumption has been linked to improved blood vessel function and reduced formation of dangerous blood clots. For seniors concerned about blood sugar management, kiwis have a relatively low glycemic index despite their sweet taste. The fiber in kiwis slows sugar absorption, preventing the rapid spikes and crashes that can be particularly troublesome for older adults. This makes kiwis a smart choice for those with diabetes or prediabetic conditions. Did you know that an apple a day doesn't just keep the doctor away? It might actually extend your golden years. The humble apple, found in every grocery store and farmer's market across the country, contains remarkable health benefits specifically valuable for seniors. These crisp, delicious fruits work silently to support your body's natural systems, particularly as we age. The soluble fiber in apples, called pectin, acts like a gentle broom for your digestive system, sweeping away cholesterol and helping maintain healthy blood sugar levels. For seniors concerned about type 2 diabetes or heart health, this makes apples an essential daily companion. The steady, slow release of energy from an apple prevents those troublesome sugar spikes that can leave you feeling tired and hungry again within hours. Apples contain something truly special, quercetin, a powerful antioxidant that fights inflammation throughout your body. This natural compound helps protect your precious brain cells and may reduce the risk of developing memory problems. The beauty of apples is their convenience. No preparation needed, just wash and enjoy. For seniors with dental concerns, apples can be easily sliced, baked, or grated into applesauce without losing their nutritional value. The skin of the apple contains most of the fiber and many of the antioxidants, so try to include it whenever possible. Studies have shown that apple consumption is linked to lower rates of heart disease, which remains the #1 health concern for adults over 65. Red apples contain anthocyanins, the same heart-healthy compounds found in red wine, but without the alcohol that can interfere with medications. The gentle chewing required for apple consumption also stimulates saliva production, which naturally protects your teeth and gums as you age. Many seniors find that incorporating a morning apple into their routine helps establish regular digestive patterns, reducing constipation that often comes with certain medications. The potassium in apples helps maintain healthy blood pressure levels, working in harmony with any blood pressure medications you might be taking. For those watching their weight, apples provide a satisfying crunch and natural sweetness for very few calories, about 95 for a medium-sized fruit. This makes them the perfect snack between meals when you need something to tide you over without compromising your health goals. Remember that different varieties offer slightly different benefits. Granny Smith apples have the highest antioxidant content, while Red Delicious apples lead the pack for heart-healthy compounds. Store your apples in the refrigerator to preserve their nutrients and crisp texture for up to a month, making them an economical choice for seniors on a fixed budget. The natural compounds in apples support bone health too, an important consideration as we age and face increased risk of osteoporosis. Now that you know the 3 fruits you must eat for better health, let's talk about the ones you should stay away from. Did you know that sweet tropical pineapple you enjoy might actually be causing problems for your health after 60? The juicy fruit that makes its way into your fruit salads and smoothies could be silently disrupting your body's balance. Pineapple contains bromelain, an enzyme that, while beneficial for some, can be particularly harsh on senior digestive systems. This tropical fruit is surprisingly acidic, with a pH level between 3 and 4, making it one of the most acidic fruits available. For seniors with sensitive stomachs or acid reflux, this can trigger painful heartburn and indigestion almost immediately. But the concerns don't stop at digestive issues. Pineapple's impact on blood sugar is what really deserves your attention. A single cup of pineapple chunks contains nearly 22 grams of sugar, which can cause dramatic spikes in glucose levels. For seniors managing diabetes or prediabetes, these sugar spikes can be particularly dangerous and difficult to control. The glycemic load of pineapple makes it problematic for those with insulin resistance, which becomes more common with age. Many seniors don't realize that pineapple sweetness comes at a cost to their pancreas, working overtime to process this sugar. Additionally, the bromelain in pineapple can interfere with certain medications commonly prescribed to older adults. Blood thinners like warfarin may interact negatively with bromelain, potentially increasing bleeding risk unexpectedly. For those with arthritis seeking relief, pineapple's acidity can sometimes worsen inflammation rather than help it. The fruit's high vitamin C content seems beneficial, but for seniors with kidney issues, it can contribute to oxalate stones. Many doctors now recommend that seniors limit their pineapple consumption to small, occasional servings at most. Instead, consider alternatives like papaya or watermelon, which offer similar nutrients with less sugar and acidity. These substitutes provide hydration and vitamins without the harsh effects that pineapple can have on mature digestive systems. If you do enjoy pineapple occasionally, try having it with protein-rich foods to slow down sugar absorption into the bloodstream. Watch for symptoms like heartburn, stomach pain, or unusual blood sugar readings after consuming this tropical fruit. Remember that your body's needs change with age, and foods that once caused no problems might now require moderation. Your health journey after 60 means making informed choices about every food, even those marketed as healthy options. The bromelain enzyme in pineapple, while touted for anti-inflammatory benefits, can actually irritate your intestinal lining. Seniors with diverticulitis or inflammatory bowel conditions should be particularly cautious with this tropical fruit. The tiny seeds in pineapple can lodge in diverticula, potentially causing painful flare-ups that might require medical attention. Research has shown that seniors are more susceptible to these digestive complications due to normal aging of the gut lining. What many health influencers won't tell you is that pineapple's acid content can gradually erode tooth enamel over time. For seniors already experiencing dental sensitivity or wearing dentures, this acidic assault can worsen oral health problems. The combination of acid and sugar creates the perfect environment for dental decay, a significant concern after age 60. Many dentists report seeing accelerated enamel erosion in seniors who regularly consume acidic fruits like pineapple. If you're taking medications for blood pressure, the potassium in pineapple could potentially interfere with their effectiveness. Nutritionists specializing in geriatric health have identified pineapple as one of the top fruits seniors should approach with caution. The rapid glucose absorption from pineapple can trigger inflammation throughout the body, worsening joint pain and arthritis. Studies have shown that sugar spikes contribute to the aging process through a mechanism called glycation, affecting skin elasticity. For seniors concerned about maintaining cognitive health, the sugar-induced inflammation from pineapple consumption is concerning. The latest research connects blood sugar volatility with accelerated cognitive decline, making stable glucose levels a priority. What makes pineapple particularly problematic is how its sweet taste masks the potential health impacts for vulnerable seniors. The food industry often markets pineapple as a natural or healthy choice, without addressing its risks for the senior population. Gastroenterologists report that many seniors struggle with prolonged digestive discomfort after consuming even small amounts of pineapple. The bromelain enzyme can continue working in your digestive system for hours, potentially disrupting sleep if eaten in the evening. Many seniors don't connect their nighttime acid reflux or discomfort with that pineapple they enjoyed earlier in the day. Another concern is pineapple's potential to interact with common medications prescribed for conditions like hypertension or cholesterol. The fruit's enzymatic properties can alter how certain medications are metabolized in the liver, affecting their potency and action. Senior health experts recommend checking with your pharmacist about potential food-drug interactions with your specific medications. Even canned pineapple, which has less bromelain than fresh, still contains problematic levels of sugar for aging metabolisms. For seniors with arthritis seeking anti-inflammatory foods, there are much better options than pineapple with fewer drawbacks. Foods like blueberries, cherries, and pomegranates offer anti-inflammatory benefits without pineapple's high sugar content. These alternatives provide antioxidants and beneficial compounds that support joint health without compromising blood sugar stability. If you're particularly fond of tropical flavors, small amounts of mango or papaya offer similar satisfaction with less acidity. It's worth noting that pineapple juice is even more concentrated than the whole fruit, making it especially problematic for seniors. Many commercial pineapple juices contain additional sugars or concentrates, further amplifying the negative health effects. The timing of pineapple consumption also matters significantly for seniors managing their health after age 60. Eating pineapple on an empty stomach maximizes its impact on blood sugar and digestive discomfort, making it especially risky. Health experts suggest that if you must enjoy pineapple, having it as part of a balanced meal with protein and healthy fats is best. The fiber in whole pineapple, while beneficial in some ways, doesn't offset the sugar load enough for unrestricted consumption. Many seniors report that after eliminating pineapple from their diet, they notice improvements in digestive comfort and energy levels. The inflammation connection is particularly important, as chronic low-grade inflammation accelerates many age-related conditions. Foods that trigger blood sugar spikes contribute to this inflammatory state, potentially worsening conditions like arthritis and heart disease. For seniors already managing these conditions, minimizing dietary triggers like pineapple can be an important part of their health strategy. If you've noticed joint pain flare-ups or digestive issues and can't identify the cause, consider tracking your pineapple consumption. Many find that eliminating this seemingly innocent fruit leads to noticeable improvements in how they feel day to day. The bromelain in pineapple also affects protein digestion, which might sound beneficial but can be problematic for seniors. This enzyme breaks down proteins so efficiently that it can sometimes cause an uncomfortable feeling in the mouth and throat. The tingling or burning sensation some experience when eating pineapple is actually the fruit's enzymes beginning to digest your tissues. For seniors with sensitive mucous membranes or dry mouth conditions, this sensation can be particularly uncomfortable or even painful. If you've noticed this reaction, it's your body sending a clear signal that pineapple might not be the best choice for your system. Additionally, pineapple's high histamine content can trigger allergic-type reactions in seniors with histamine sensitivity. Symptoms like headaches, flushing, nasal congestion, or skin itchiness after eating pineapple could indicate this sensitivity. As we age, our ability to process and break down histamines often decreases, making fruits like pineapple more problematic. For seniors already taking medications that affect histamine processing, such as certain antidepressants, the effects can be amplified. The combination of high sugar, acidity, and histamine makes pineapple a potential triple threat for senior health and comfort. Those innocent-looking dried fruits in your pantry might be compromising your health goals after 60. What many seniors consider a healthy snack option is actually one of the most sugar-concentrated foods available. Dried fruits like raisins, prunes, and apricots remove the water content while concentrating all the natural sugars. A small handful of raisins contains nearly the same amount of sugar as a candy bar, but without the same satisfaction. This concentrated sweetness creates a perfect storm for blood sugar management, particularly challenging for seniors. The glycemic index of most dried fruits is surprisingly high, triggering rapid spikes in blood glucose levels. For adults over 60, these sugar surges can be especially problematic as glucose tolerance naturally decreases with age. Many seniors don't realize that a quarter cup of dried cranberries contains more sugar than a chocolate chip cookie. The food industry markets these products as natural alternatives to candy, obscuring their impact on metabolic health. What makes dried fruits particularly deceptive is their reputation as healthy, fiber-rich snack options for seniors. While they do contain some fiber, the sugar-to-fiber ratio is dramatically skewed, negating many of the potential benefits. The concentrated nature of dried fruits makes it incredibly easy to overconsume calories without feeling satisfied. Just consider how many dried apricots you might eat compared to fresh ones, typically 3 or 4 times more. This calorie density can contribute to weight gain and metabolic issues, already a concern for many adults over 60. Even unsweetened varieties still pack an enormous natural sugar punch that can affect insulin sensitivity and resistance. For seniors managing diabetes or prediabetes, regular dried fruit consumption can make blood glucose control nearly impossible. The sugar concentration is so high that even small portions can destabilize carefully managed glucose levels for hours. Medical researchers have identified dried fruits as particularly problematic for seniors with metabolic syndrome. The combination of sugar and calories in such a small package makes portion control exceptionally difficult. Many seniors don't realize that the recommended serving size for dried fruits is typically just 1 tablespoon. That colorful trail mix with dried fruits marketed for /energy/ could be sabotaging your health management efforts. The sulfites used to preserve many dried fruits add another layer of concern for seniors with respiratory conditions. These preservatives can trigger asthma-like symptoms or breathing difficulties in sensitive individuals, especially older adults. Studies show that sulfite sensitivity becomes more common with age, affecting up to 10% of the senior population. Even organic dried fruits often contain concentrated sugars that can contribute to inflammation throughout the body. The digestive impact of dried fruits is another significant concern that's rarely discussed in health circles. Their concentrated nature can cause gastrointestinal distress, bloating, and uncomfortable gas in sensitive systems. For seniors already managing sensitive digestion, dried fruits can trigger or worsen symptoms of irritable bowel syndrome. The high fiber content, while beneficial in theory, can be too much for some seniors' digestive systems to handle comfortably. Even dried fruits marketed specifically for digestive health, like prunes, should be consumed with caution after 60. While occasional consumption may help with regularity, daily intake can lead to dependence and digestive system imbalance. Many gastroenterologists recommend that seniors find gentler ways to support digestive health than dried fruit consumption. What's particularly concerning is how dried fruits are often recommended without considering individual health profiles. Seniors with fructose sensitivity or malabsorption may experience significant discomfort from these concentrated fruit sources. The symptoms might include bloating, abdominal pain, and diarrhea, problems already common in the senior population. Another hidden risk is the potential interaction between dried fruits and common medications prescribed after 60. The high potassium content in dried fruits like apricots and prunes can interfere with certain blood pressure medications. Seniors taking ACE inhibitors or potassium-sparing diuretics should be particularly cautious with dried fruit consumption. The combination could potentially lead to dangerous potassium levels that affect heart rhythm and kidney function. Additionally, the concentrated nature of dried fruits can affect absorption rates of certain medications in the digestive tract. Pharmacists rarely warn patients about these potential food-drug interactions when dispensing common senior medications. Health advocates for seniors recommend checking with healthcare providers about specific dried fruits and your medication regimen. What makes this especially concerning is how dried fruits are often included in /health food/ products marketed to seniors. Many granolas, breakfast cereals, and energy bars targeted at older adults contain substantial amounts of dried fruits. These hidden sources can add significantly to your daily sugar intake without your awareness or conscious choice. The oxidation that occurs during the drying process creates another layer of concern for health-conscious seniors. This oxidation destroys many of the beneficial antioxidants that make fresh fruits so valuable for healthy aging. While marketing focuses on the concentrated nutrients in dried fruits, it rarely mentions this significant nutrient loss. For seniors seeking true antioxidant benefits to combat age-related oxidative stress, fresh fruits are vastly superior. Many dried fruit manufacturers add oils to prevent sticking, introducing additional calories and sometimes trans fats. These added oils can contribute to inflammation and cardiovascular concerns already prevalent in the senior population. What makes dried fruits particularly insidious is how they're positioned as healthy despite these significant drawbacks. Many senior nutrition programs still recommend dried fruits without addressing their potential metabolic impact. Research in geriatric nutrition increasingly questions the place of dried fruits in optimal diets for adults over 60. The combination of high sugar, calorie density, and low satiety makes them particularly problematic for seniors. If you're watching your weight after 60, dried fruits can be especially counterproductive to your health goals. Their calorie density makes it incredibly easy to consume several hundred calories in just a small handful. For comparison, a cup of fresh blueberries contains about 85 calories, while a cup of dried blueberries exceeds 500 calories. This dramatic difference can sabotage weight management efforts without providing proportional nutritional benefits. Given that metabolism naturally slows with age, these extra calories can contribute significantly to unwanted weight gain. Excess weight around the midsection, common after 60, increases inflammation and risks for cardiovascular disease. Many seniors don't realize that replacing dried fruits with fresh alternatives could substantially support weight management. The water content in fresh fruits helps create fullness and satisfaction that dried versions simply cannot provide. Nutritionists specializing in senior health increasingly recommend fresh fruit consumption over dried in nearly all cases. If convenience is a concern, frozen fruits offer most of the benefits of fresh without the sugar concentration of dried. The impact on blood sugar stability cannot be overstated when it comes to dried fruit consumption after 60. Stable blood glucose levels are increasingly recognized as crucial for cognitive health and dementia prevention. Research links blood sugar volatility with accelerated cognitive decline and increased risk of neurodegenerative diseases. For seniors prioritizing brain health, avoiding the glucose spikes from dried fruits becomes particularly important. The insulin response triggered by dried fruit consumption can create a cycle of energy crashes and fatigue. Many seniors mistakenly reach for more dried fruits during these energy lows, perpetuating the blood sugar roller coaster. This cycle can significantly impact quality of life, affecting energy levels, mood stability, and cognitive function. Healthcare providers specializing in senior wellness increasingly recommend removing dried fruits from daily consumption. Instead, they suggest focusing on fresh fruits with lower glycemic impact like berries, apples, and citrus fruits. This exotic Asian fruit has gained popularity in recent years for its unique flavor and fragrant aroma. Lychee's sweet, floral taste makes it a favorite in desserts, drinks, and as a standalone treat for many seniors. But beneath its bumpy red exterior lurks a sugar content that rivals some of the sweetest fruits on the planet. A single cup of fresh lychee contains nearly 29 grams of sugar, significantly more than most common fruits. For seniors monitoring their blood glucose levels, this seemingly innocent fruit can cause dramatic sugar spikes. The glycemic index of lychee is particularly high, meaning its sugars are rapidly absorbed into the bloodstream. This quick absorption can cause glucose levels to soar within minutes of consumption, taxing aging metabolic systems. What makes lychee especially problematic is how easy it is to consume multiple fruits in a single sitting. Their small size and addictive sweetness can lead to overconsumption before you realize how much sugar you've ingested. For seniors with diabetes or pre-diabetic conditions, lychee presents a particularly challenging blood sugar management issue. The fruit's impact doesn't stop at blood sugar concerns. Lychee contains compounds that can interfere with medication. Research has identified several bioactive compounds in lychee that may interact with common prescriptions for seniors. Blood pressure medications, statins, and blood thinners may all be affected by regular lychee consumption. These potential interactions are rarely discussed when lychee is promoted as a healthy, exotic fruit option. Another concern is lychee's tendency to trigger inflammation in susceptible individuals, particularly seniors. The fruit contains natural compounds that can exacerbate inflammatory responses in joints and tissues. For seniors managing arthritis or other inflammatory conditions, lychee consumption may worsen symptoms. What's particularly deceiving is how lychee is often marketed as an anti-inflammatory food due to certain antioxidants. This conflicting information makes it difficult for seniors to make informed choices about including it in their diet. The reality is that for many adults over 60, the sugar content far outweighs any potential anti-inflammatory benefits. Lychee also contains compounds that can impact kidney function, a particular concern for seniors with reduced function. The fruit's high potassium content may be problematic for those with kidney disease or taking certain medications. Healthcare providers rarely warn patients about this specific fruit when discussing dietary restrictions for kidney health. The combination of sugar load and bioactive compounds makes lychee uniquely challenging for aging kidneys to process. Digestive sensitivity to lychee is another issue that becomes more common after age 60, often manifesting as bloating or discomfort. The fruit contains several compounds that can trigger digestive distress in sensitive individuals. What makes this especially problematic is that many people don't connect their symptoms with lychee consumption. The exotic nature of the fruit means many seniors don't have lifetime experience with how their bodies respond to it. This unfamiliarity can make it difficult to identify lychee as the source of new digestive or inflammatory symptoms. Dental health considerations provide another reason for seniors to approach lychee with caution in their diet. The combination of high sugar content and acidity makes lychee potentially damaging to aging dental structures. Seniors with receding gums, exposed roots, or dental work may experience increased sensitivity after consuming lychee. The fruit's sugars can feed harmful bacteria in the mouth, potentially contributing to decay and gum disease. These dental concerns are particularly relevant for seniors already experiencing age-related changes in oral health. What many don't realize is that age-related dry mouth conditions can amplify lychee's negative effects on dental health. Without adequate saliva to neutralize acids and rinse away sugars, the impact on teeth can be significantly worse. Dental professionals increasingly advise seniors to be cautious with high-sugar fruits like lychee to protect oral health. The combination of sugar content and acidity creates a particularly challenging environment for maintaining dental integrity. Many seniors are surprised to learn that even natural fruit sugars can contribute significantly to dental problems. The cognitive impact of rapid blood sugar fluctuations from lychee consumption deserves special attention for seniors. Research increasingly connects blood glucose volatility with cognitive decline and acceleration of memory problems. For adults over 60 concerned about maintaining brain health, stable blood sugar levels should be a primary consideration. Lychee's high sugar content and rapid absorption create precisely the kind of glucose spike that research finds problematic. The temporary energy boost from lychee consumption is often followed by a crash that can affect mental clarity and focus. Many seniors report brain fog or difficulty concentrating after consuming high-sugar fruits like lychee. What makes this particularly concerning is how these cognitive effects can mimic or exacerbate age-related memory changes. Neurologists specializing in cognitive health increasingly recommend dietary patterns that maintain stable glucose levels. For seniors already experiencing mild cognitive changes, avoiding blood sugar spikes becomes even more critical. The link between metabolic health and brain function grows stronger with each new research study published. Another concern is lychee's potential impact on sleep quality, an already challenging area for many seniors. The sugar content can affect blood glucose levels throughout the night, potentially disrupting healthy sleep patterns. Lychee also contains compounds that can affect neurotransmitter activity in sensitive individuals, particularly seniors. These natural chemicals can trigger headaches or migraines in those with susceptibility to such reactions. For seniors already managing frequent headaches or neurological sensitivity, lychee might be an unidentified trigger. These reactions become more common with age as the blood-brain barrier naturally becomes more permeable. What makes identification difficult is the exotic nature of lychee. Many seniors don't consume it regularly enough to notice patterns. Healthcare providers rarely include this specific fruit in discussions about dietary headache triggers for older adults. The unique combination of compounds in lychee creates a profile unlike more common fruits in Western diets. For seniors experiencing unexplained headaches or neurological symptoms, tracking lychee consumption might be revealing. Neurologists specializing in headache management have begun including exotic fruits like lychee in elimination diet protocols. The growing popularity of this fruit means more seniors are experiencing its effects without understanding the potential connection. The impact of lychee on weight management presents another consideration for health-conscious seniors. While seemingly light and refreshing, lychee's high sugar content contributes significantly to daily caloric intake. The fruit's minimal protein and fat content means it does little to create lasting satiety despite the calories consumed. For seniors already facing metabolic challenges, these empty sugar calories can undermine weight management efforts. What's particularly deceptive is how lychee is often positioned as a healthy alternative to traditional desserts. In reality, a serving of lychee can contain as much sugar as conventional treats without the same satisfaction factor. Nutrition experts specializing in senior health increasingly recommend fruits with higher fiber and lower sugar content. Options like berries, apples, and citrus fruits provide similar refreshment with more balanced nutritional profiles. For seniors concerned about maintaining healthy weight and metabolic function after 60, these alternatives are superior choices. The combination of high sugar, low fiber, and minimal protein makes lychee a particularly poor choice for weight-conscious seniors.